Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Ms. Jeannie Porter, who is a physical therapist out at Family Practice Associates. Welcome.
Thank you for having me.
Now, physical therapist, first of all, what is physical therapy? When I say that, give me an idea.
Okay, physical therapists use a non-invasive approach to patient care. We assist patients in relieving pain and restoring the loss of function, maybe because of pain or maybe loss of strength, loss of flexibility.
So that involves a lot of joints, a lot of motion, a lot of things. So tell me some of the things, the list of things you treat.
Okay. So we treat a variety of issues. Probably one of the most common would be back pain, closely followed by neck pain, loss of balance, history of falls or risk of falls, overuse injury such as tendonitis that can occur in the rotator cuff, the bicep, around the elbow, the wrist, the hip, the knee, the ankle, almost anywhere. There are tendons all over the body. We also treat more chronic conditions such as degenerative arthritis, degenerative disc disease, and those sorts of things.
Now, you mentioned back pain right out of the gate, and as a family doctor, we see a lot of back pain, a lot of chronic back pain, a lot of acute back pain, and sometimes just hard to get rid of. Tell me a little bit about what you do, and maybe are there some things the patients can do to maybe prevent or protect or treat themselves?
Okay, yes. So one of the big things is maintaining an active lifestyle. So the National Institute of Health recommends 150 minutes a week. That breaks down to just over 20 minutes a day of moderate activity. So a lot of times people think, oh, my back is hurting, I need to go lay in the bed. But what they may really need to do is get up and move. Also things like avoiding prolonged positions. If you are sitting at a desk all day, you really do need to be attentive to breaking up those prolonged stressful postures. Also, if you're working a more physical job where there's a lot of bending and lifting involved, you want to be sure you're educated on proper body mechanics. How do you lift in order to protect your back? If a load is too heavy for you, then ask for help rather than trying to manhandle it and injure yourself.
You also mentioned kind of briefly there fall risk. And for our elderly population, well, I guess for a lot of people, it's a problem because fall risk it can lead to a lot of injuries. Are there things you can do to prevent that?
Yes, there are. And I'll repeat again, maintaining an active, healthy lifestyle. That is one of the bigger preventive things that you can do, staying strong and flexible. But if you are already having loss of balance, there are things you can do within your home, such as clearing clutter from your walkways, removing throw rugs, making sure that your walkways, your stairways are adequately lit, especially if you're going to get up at night. You're going to want to have a light source so you can see your way to the bathroom without stumbling and tripping. The bathroom is a place that a lot of falls occur. And so doing things like installing grab bars to help you get safely in and out of your tub or shower, that can be very helpful. And then putting a seat in the place where you get dressed, because you might not be able to stand on one leg and step into your pants like you did when you were in your 30s or 40s. So, our senses decline as we age. They all do. We need glasses to help us see and hearing aids to help us hear. And we also need to maintain that strength and flexibility, the sensation in our feet that gives us feedback for the surface that we're walking on.
Now, you just mentioned strength, and I'm going to ask you about if you're weak, you're all at risk for all those things. I know your answer is going to be the same other two that you said, but you maybe ought to repeat it and tell us, is there some other things that you can do, and do you treat people or you're just weak?
We do see a lot of people who are just weak, and that can then lead to things like fall risk or like back pain or neck pain. And so I would echo what our physician said earlier, early intervention. Don't wait so long and think, well, this is going to go away. And it might, but if it doesn't go away in a few days and you're having pain or you're having difficulty with mobility, it's really better to get that checked out and possibly get a referral to a therapist who can then assess you and customize a treatment plan for you and educate you in how you can help yourself. That's one of the big things that we advocate as therapists, is empowering the patient and giving you the tools that you need to manage this problem if it's a chronic, ongoing problem.
So when you have a patient, whether it be back pain or a tendon pain or weakness or fall, you can teach them things, you can treat them and teach them things that they can carry on through the normal activities of daily living.
Absolutely, yes. And that is crucial. You will get out of therapy oftentimes what you put into it. And so it's really important to follow those recommendations and to use those things you've learned in your physical therapy sessions.
Well, that's great information. We thanks for the care that you give the patients at Family Practice, and if you got back pain, you're the one.
My pleasure.
All right.
Thank you.
We'll be right back.